Good morning. Welcome to the program. When it comes to permanent birth control, a woman is twice as likely as a man to have surgery. But female sterilization is much more complicated and dangerous than the comparable surgery in a man, that being a vasectomy. And what if I told you a vasectomy was done with no needle, no scalpel, and no pain? That's right. And it's happening here in Northwest Ohio. Today, we are joined with Dr. Puneet Sandwani, who is the Chief of Male Infertility and Reproductive Health Services at University of Toledo Medical Center. We will discuss the no needle, no scalpel vasectomy. Please enjoy the show.
You're living a full and productive life because you've always committed to giving the best of yourself to everything you do. And there's so much to look forward to: children's weddings, the second honeymoon, your philanthropic work, just to name a few. The dedicated physicians at Toledo Cardiology Consultants are committed to your cardiac excellence, so you'll be there for the experiences of your lifetime that are yet to come. To learn more, visit Toledo Cardiology at toledocardiology.com. That's toledocardiology.com.
At Ballast Buick GMC, you can make luxury your reality in an all-new 2017 Buick LaCrosse, designed for the ultimate quiet and luxurious driving experience. Or picture your family in a luxurious, roomy SUV, complete with DVD system, heated seats, and a 4G Wi-Fi hotspot. Choose from the popular compact Buick Encore to the gorgeous Buick Enclave. We invite you to browse our website, ballastbuickgmc.com, or stop in soon. Remember, at Ballast, you are family.
Life is filled with uncertainties. Your career, your health, your family situation, they're all subject to change. So how can you plan for your future when you don't know what it will hold? The Root Prisby Williams Group, a financial advisor team at Morgan Stanley, can help. Joel, Jim, and Deb will work with you to create a wealth plan and to help you manage your investments through all the changes. And the great thing is, they're right here in Northwest Ohio. To make an appointment with Joe, Jim, and Deb, call 419-842-6505. Investments and services offered through Morgan Stanley Smith Barney LLC, member SIPC.
Honey, do you remember this mole being there before?
No, I don't. We better get that checked out. I'll call Renaissance Dermatology.
Didn't they treat your eczema?
Yeah, but they can handle the full spectrum of skin conditions. They can screen to see if it's a problem, and if it is, they can handle the surgery too.
Will it take long to get an appointment?
No, Renaissance Dermatology is timely and efficient. That's why I trust them.
Sounds like they know what they're doing. Go ahead and call.
5951 Renaissance Place in Toledo. Call 419-824-2288 for an appointment. Renaissance Dermatology.
You're living a full and productive life because you've always committed to giving the best of yourself to everything you do. And there's so much to look forward to: children's weddings, the second honeymoon, your philanthropic work, just to name a few. The dedicated physicians at Toledo Cardiology Consultants are committed to your cardiac excellence, so you'll be there for the experiences of your lifetime that are yet to come. To learn more, visit Toledo Cardiology at toledocardiology.com. That's toledocardiology.com.
Good morning. Thank you for joining us. Thank you for being here, Dr. Sandwani.
Glad to be here.
And I was impressed with your information and your CV and your knowledge about the subject which we are going to discuss, which is a very delicate subject, let's put it that way. And I'm sure you already had that addressed many times.
Absolutely, yes. It's something which is probably most scary to most men.
Yes.
Knowing that vasectomy is the most effective way of contraception. Better than tubal ligation, better than contraceptive pills, least failure rate. Still, it's underutilized just because of that, because most men are afraid of the pain that's going to happen with the procedure, the injection they're going to get in that area.
Absolutely.
So you're right, delicate is the word.
Okay, so let's start immediately talking about that subject, which is you have that program, which is you are the only program, or University of Toledo has the only program, which is no needle, no scalps, basically vasectomy. So can you tell us a general idea, what's that program? What's the difference between that and the vasectomy, the standard one which we have around the nation?
Right, absolutely. So no needle, no scalpel vasectomy is relatively newer concept as compared to vasectomy. When vasectomy was being done, the evolution of the procedure happened that they did in China. When they did the mass vasectomies, they let go of the scalpel first. Yes. So you can do it through a puncture of the skin, deliver the vas, and then clip the vas or cauterize it, or tie it and then drop it back. So there was a first improvement with no scalpel vasectomy.
Okay.
But then people saw that still the acceptance in men was not that high because they were afraid that they're going to get local anesthetic in the area with the needle injection, which was pretty painful.
Absolutely.
So then the next iteration of it came because you wanted no needle device. And this is a really interesting story because this is basically NASA developed this device, which is a high pressure jet spray. It was used for mass immunizations. It has no needle. It has very fine nanopores through which when you put a liquid under high pressure, it becomes, it atomizes it. So it becomes so fine, it can go through the skin, underlying structures, and sometimes up to the depth of a centimeter inside.
Okay. So by using that spray, technically you are applying some kind of anesthetic medicine, but without the needle.
Without the needle.
That's a simple way.
That's a simple, right.
Okay.
So that's how it works. So you have to roll the vas in a certain way so that comes to, the tube comes to next to the skin. And not only that, you have to roll it so that the part which is rich in nerves comes up first.
I see.
Now when you have it, then you fire this device and the spray goes in through and through, and those nerves are then desensitized.
Okay.
And basically you use 0.25 ml, which is the minuscule amount
Very
that
small.
you use. So it does not distort the anatomy, it doesn't cause hematoma, minimizes the trauma. After that you just take a puncture device, you can do your procedure, drop it back in. We did actually study and we published in Canadian Urology Association Journal.
Okay.
And we looked at the men about the perception of the pain and what actually they were anticipating and what is actually pain felt during the procedure. We showed that their anticipation was 3 times worse than actual procedure pain.
Wow.
And on a scale of 1 to 10, we used a visual analog scale, and it showed that their average pain scale was 2.3. Which they said was as bad as maybe flick of a finger, or some people described as ant bite, equivalent of an ant bite.
So based on this technology, how long is this procedure takes?
It takes us 5 minutes on each side.
5 minutes.
Because unlike needle anesthesia where you have to wait, here you don't have to wait. Once the spray is in and mist is in, because the fine structure diffuses and it causes right away anesthesia right away.
That's great. And what about the effectiveness? Since you did multiple studies, is the effectiveness of this technique the same, better, worse than the original idea of vasectomy?
So
same.
The effectiveness of the vasectomy remained the same. The failure rate of vasectomy remains 4 in 1,000.
Okay.
So once again, it's really, really effective procedure.
And the success rate of the procedure is what?
So,
95%?
That'll be 99.996%.
So it's almost 100%.
Right, almost 100%.
Okay. So what is the possible risk of this procedure? I mean, even that it's very minimal, the way you are describing it, 5 minutes on each side. What's the possible risk of this procedure?
So most important thing to remember is anytime you operate in an area which has blood vessels around it, so formation of a hematoma, because it's a minimally invasive technique. Everything is done through a 3 to 5 millimeter puncture.
Okay.
We let the nature takes care of the bleeding afterwards when things are just dropped back in. So it can stir up bleeding and collection of blood underneath. So that's a hematoma, which is typically self-limiting. You don't do anything, ice and rest is the way to go.
Okay.
So that's one of the things. Other is some people after vasectomy can have some pain which can be prolonged. In some people you have to make sure that they take appropriate rest and they don't do any heavy lifting or straining for a short period of time after the procedure.
So in general, for the procedure like that, what is the instruction for the patient? Like how long are they going to be off work? How long they have to lie down and not to do that much of activity? You know, some of us is exercising on a regular basis. I mean, so what is the specific instruction after the procedure?
So we always tailor make the instructions according to the patient's job. If you're doing desk job, you're okay to go back to work next day.
Sure.
If you're doing manual job, you may need an extra day of rest. So they can go back, but important thing is at that time we tell them to use a scrotal support. So make sure a tight athletic underwear or something that will make their less movement in the area. Okay. Well, they always tolerate it well. Otherwise from that, there's no other precaution that we ask them to.
Okay. Now I'm going to expand a little bit on the subject. And the question about the vasectomy always comes, is it reversible?
Yes, excellent question. So during the initial consultation, when somebody comes to us seeking vasectomy, it is very important in that time to talk to them that unlike other options, this is considered permanent for all practical purposes. And there's a reason behind it. And the reason for that is, in case life takes a turn, something happens and you want to have more kids. In that case, it requires another surgery to freshen the ends and bring the ends back together and reverse the vasectomy. It can be reversed, yes, absolutely. The success rate of reversal depends on multiple factors. It may not be 100%. You may still get sperms, but they may be bad quality. It depends on how long interval has taken place since your vasectomy. The longer you go from your vasectomy, the lesser the chances of having good quality sperms to be retrieved afterwards.
Absolutely. So in that case, what's your recommendation for the younger generation who they just don't want to have kids at this point? I mean, is it ideal to have the vasectomy, or they have to be sure that they are not going to have kids for long term?
That's a great question. And it's coming more and more common due to lifestyle choices. We see younger couples coming to us and saying, we just don't want any kids, and they have no kids.
Okay.
So how do you proceed? This is a young couple. Life may take a turn. Things may change. They may change their mind afterwards. So you always counsel them, not only at that point for considering other options, but also to cryopreserve, which means freeze the sperms ahead of time. So that in case this thing happens, all vasectomy patients at our practice, at UTMC, we have the facility that we can cryopreserve sperms ahead of time.
Okay.
So that this does not kind of throw them off later on.
That's great.
And they can cryopreserve, and then they want to proceed. And years later, if they want to come back and use their own stored specimen, they can have good success with that.
Absolutely. Now, bringing me to the cost of this procedure and insurance coverage, how is that working at this point?
We have not had any issues because the procedure code for the vasectomy is same, whether you're doing it no needle or whether you're doing it with needle, with scalpel, without scalpel. Good thing is because you're doing it in office, so it's just an office procedure copay. So it's not under ASC copay, which is higher, or surgery copay when some patients are getting over there in the hospital.
Absolutely. And what about the fertilization? I mean, if they want to freeze their sperm or anything like that, how does that work? Is it out of pocket, or there is some insurance coverage?
So it depends on your insurance plan. So you have to get pre-authorization. You have to make sure your insurance pays for it. In my experience, there are very few and far between insurances that will cover it for you. Okay. Most of the time, it's going to be your own expense. So you may have to, I forget the exact amount. I think it's $300 or $500.
Absolutely.
You have to give.
Now, if you want to give a message to the general public about vasectomy, I mean, this is the one which is many people, they are fearful of just hearing it. What can you tell them about how safe, how easy procedure, and if really someone interested to have this procedure done, that there is nothing to be concerned about?
Yeah, absolutely. So one thing that people need to know, that of all the available contraception options, vasectomy is most effective.
Yep.
Better than tubal ligation, better than contraception, better than barrier contraception pills. And it has the highest success rate with minimal amount of complications. Absolutely. Much lesser complications than tubal ligation, where you're going actually in the abdominal cavity. Yep. So there's higher chance of injury. The complication rate is 1%. Whereas with vasectomy, the major complication rate is 1 in 10,000.
Wow.
So it's really, really rare where you have to go back to surgery to get something done.
Now, if there's any difference between the type of patient, like I'm going to throw this example, if there is an obese individual, overweight versus an average person, I mean, is the complication rate the same, or there is some other comorbid factor which is we have to put in consideration?
Right. So typically, you'll be surprised that the scrotal skin is not affected by obesity as much, because it stays thin, because nature has a mechanism by which your thermoregulation is still to be maintained to have good quality sperm production. So other conditions, however, can complicate vasectomy. For example, there's a certain anatomy called shawl scrotum in which you may not be a candidate for this. Okay. A person who has had previous injury, trauma, or scarring so bad that the skin is scarred up and that you cannot reach the vas.
Sure.
So those are the patients probably you cannot do a vasectomy without giving them general anesthetic. Very rare, happens maybe once or twice a year that you run into this kind of patient population.
Does the number of procedure done by the surgeon play a role in their experience?
Absolutely. Like any skill that you have as surgeon, as a procedurist, you probably know, the more you do, the more variations you have seen, and the more comfortable you get. And by doing that, your complication rate goes down or your success rate goes up. Is there a formal study? I have not seen any that people have looked at it, but it's a great idea to probably go back and look at it. Yeah.
Absolutely. So after this procedure is done, most common fear I think every man has is possible erectile dysfunction, or his sexual drive is not going to be the same. Can you elaborate on that subject in more details?
Absolutely, and you're right, this is probably most common fear, unspoken fear.
Yep.
That's why men don't come forward, because they think for some reason they're going to have problems with the sexual function, or they're going to have problem with satisfaction.
Mm-hmm.
And there are studies after studies that have shown this is not true.
Okay.
The mechanism of fertility and mechanism of sexual function is totally unrelated. Okay. Sexual function is more related to actually your cardiovascular status. Mm-hmm. The new term for ED is now endothelial dysfunction rather than erectile dysfunction.
Absolutely.
So probably nobody knows that better than you. And so it's more of a vascular neurogenic phenomena, whereas the fertility and the vasectomy part that we do is a totally causing obstruction of the vas so that the sperms don't flow through, and they're not related at all.
Okay, what about the hormonal changes? I mean, if there's any hormonal changes with the procedure-related outcome?
Once again, great question, because patients ask us all the time, am I going to feel less of a drive? Is my libido going to go down? And the short answer is no. There were studies that were done in stable couples. They looked at their satisfaction scores before the vasectomy and then after the vasectomy.
Sure.
And it showed that there was less anxiety of having unplanned pregnancies. So there was more satisfaction in the couples who have had vasectomy as compared to couples who did not. So if anything, they were more engaged and they were more satisfied after the procedure. No hormonal consequences at all.
Great. If there's any age limitation for this procedure?
No. The society is changing. We do see couples who are coming in late. We do see couples where the male partner may be elderly, but they still have a female partner where there's a potential that they can make them pregnant. So there's no age limit.
No age limitation. That's great. We really appreciate all of the information and the input about this subject, and I hope we introduced enough information to the public to visit you and visit the only center we have in Toledo with no needle, no scalp, basically vasectomy, and we wish you the best of luck.
Thank you so much. I appreciate your time.
You're living a full and productive life because you've always committed to giving the best of yourself to everything you do. And there's so much to look forward to: children's weddings, the second honeymoon, your philanthropic work, just to name a few. The dedicated physicians at Toledo Cardiology Consultants are committed to your cardiac excellence, so you'll be there for the experiences of your lifetime that are yet to come. To learn more, visit Toledo Cardiology at ToledoCardiology.com. That's ToledoCardiology.com.
At Ballast, there are no worries. Buy a certified pre-owned vehicle from Chevy, Buick, or GMC and you're protected. Because all those 2012 to 2017 vehicles come with 2 factory-backed auto warranties that combine to provide fantastic coverage. A new, longer 6-year, 100,000-mile powertrain limited warranty and an impressive 12-month, 12,000-mile bumper-to-bumper limited warranty, both with a $0 deductible. Ballast Buick GMC on the Central Avenue Strip and ballastbuickgmc.com.
Every day you listen to the news, but how is that news affecting your financial world? Things like your retirement and your kids' college fund. You need someone who can help you work towards that goal. Someone to help you move forward in these times of change. Call the Roop Prisby Williams Group at Morgan Stanley. Joel, Jim, and Deb each have 25 years of experience as financial advisors, and their team is right here in Northwest Ohio. To make an appointment with Joe, Jim, or Deb, call 419-842-6505. Investments and services offered through Morgan Stanley Smith Barney, LLC. Member SIPC.
Ugh, I'm breaking out again.
How about I make an appointment for you at Renaissance Dermatology?
Really?
Sure. They provide a full spectrum of medical and surgical services for a wide variety of skin conditions.
Mom, you're the best.
And they can teach you about skincare and how to avoid skin cancer.
Will it take long?
Nope. Renaissance is timely and efficient. We'll get you cleared up in no time.
How do you know so much?
See a big mole on my chin?
No.
There you go.
Call 419-824-2288 for an appointment. Renaissance Dermatology.
Thank you, Dr. Kabour. Appreciate your opportunity for me to talk to a patient who actually went through this procedure. Let me introduce Jennings Smith. Welcome, Jennings.
Hi, thank you.
So I just wanted to know what went into the decision making of getting a vasectomy. Were you afraid? How did you research? What all did you do? Can you share with us, please?
Yeah, so my wife has a condition where we found during the last pregnancy, and she just delivered a couple days ago, but she was pregnant when I came and saw you, that if she's pregnant and she's not on blood thinners, or we don't know she's pregnant, she had a clot from her hip to her foot, so it could kill her. So we decided, we need to take care of it, so permanent birth control. And at first, as a man, we don't want to do vasectomies. We feel like something's not right with that. It's not manly. It's not masculine. And I said, oh, you just can get tubes tied. It sounds easier. And I have huge procedural anxiety. So when I looked into tubal ligation, though, the more I read, the more my eyes were big. And I was like, okay, so this is not an easy procedure. General anesthesia, pain, no lifting, bleeding, future problems. So I decided I was going to get a vasectomy. But I do not like procedures, and I do not like needles.
What is your biggest fear about the procedure?
Needles.
Okay.
Getting poked with a needle is not ideal for me in the arm. So when you're poking me in places that are more sensitive to me, I don't go well with that. So I looked it up, and I thought, okay, I can give this a try. So that's how I found you. You are like the only one in this area currently, I think, that performs a needleless, scalpelless procedure. So that's how we ended up in front of you last month.
Thank you for sharing that. Now, what was your experience going through the procedure?
It was actually amazing. I haven't, so personally, I've passed out several times from blood draws procedures. I get an anxiety that climbs, and then my blood pressure drops, and I'm out. So I was a little worried, but the medication you gave us before each patient gets with you, it helped calm me enough to just not stress out to a point where, and I read online about it, and there's things you could test to see if the pain is all right. I won't go into detail on TV what those were, but those are extremely painful. And I thought, okay, this is going to be rough, but the procedure itself was a breeze. I didn't have any problems with it. I was amazed how much pain-free procedure that was compared to what I read online and the videos and YouTube and all this stuff where people are like, it's terrible, it's horrible. I walked out of there and felt great.
How about recovery?
The first 2 days, I felt like I was no pain. And then day 3, day 4, when I went back to work and I was standing up all day, I started to get real sore towards the end of the day, and I wasn't taking anything. I didn't want to. So I did have to take a Motrin the 3rd and 4th night. But after that, it just disappeared again day 5, and I haven't had anything since.
Did you have to have any special approval from the insurance for no needle, no scalpel vasectomy?
No, I called my insurance, and they said, it is a higher cost, so my percentage would be a little bit higher, but I was willing to pay it for the difference in procedures versus the old way versus this new way. So they said, go ahead and get it, and I didn't need any pre-approval or anything.
Were you worried about any specific complications, especially?
I was worried about swelling and infection, because the people you talk to, just seems the people you happen to randomly ask, oh, actually, I had an infection and I ended up with but I didn't have any of that. Nothing that I wasn't expecting.
Some couples choose to freeze their sperms ahead of time. Did you have that discussion with your spouse?
We did.
What decision did you make?
Because of her condition, we decided that freezing my sperm was pointless when we were going through for what we were doing this for. It was no reason, but we decided no, that wasn't the thing we wanted.
Anything else that comes to your mind you want to share with the viewers about vasectomy education, since you are yourself a healthcare provider, so feel free.
I guess what I could tell most men that are out there that are stressed out about it, have this anxiety and this fear, not to look on the internet because it doesn't do you any good. Don't try some of the things online they say to test the pain levels. Rubber bands aren't your friends. That you should just find a doctor you're comfortable with. That the needleless, scalpelless really is the way to go in terms of, I have a friend that did needle, and he still 6 weeks later is still having a lot of pain from just where he got poked. He doesn't know why. But needleless, scalpelless was just a complete opportune thing for a male that wants to get it done, be stress-free, not having a lot of anxiety, and also get back on their feet quicker and get back to work, or if they have children already at home, they want to pick up because there's more restrictions to the old way. So the new way is definitely for the man that wants to keep going after he gets it done. So.
Some men are kind of concerned about how it's going to affect their sexual activity, and that there's a lot of folklore out there, although it's not scientifically based at all, that it affects your sexual function. Do you mind sharing your experience?
No, I first couple days, I was ready. The wife was a little bit more hesitant than I was, and then no, it was amazing. After that, it was fine. I did realize when we first had intercourse, and then a few days later, I felt like a little bit more pressure, a little bit more pain, because I think it was inflamed from the surgery or whatever you call it, the procedure. But after that, about the second time after intercourse, it was gone again, and we've never had a problem since.
Jennings, thank you so much for taking time out and sharing your experience. Not many men are brave enough or open enough. I appreciate your candid approach. Thank you.
You're welcome.
Thank you for joining us. And again, after listening to all of this discussion, please, if you have any question, always go back to your family doctor. He will be the captain to guide you where to go. And please, remember, time waits for no one.